Welcome.
Hosh Amdeed.
Welcome!
Salamat datang.
Welcome to the UK.
Sodua there to the UK.
Welcome to the UK.
Welcome.
G-I-Anu.
Welcome!
Welcome to the UK.
Welcome to the UK.
Welcome to the UK.
Welcome.
Welcome!
Welcome. I'm Professor Steve Ash. I'm the AUC Clinical Dean for the UK. I hope you find the information in this following video is of use to you.
Hey guys, so I'm doing my surgery and psychiatry rotation here at Ealing Hospital. So what are some things you need to know about the hospital settings? To start off, consultants basically means attendings. Registrars are your residents. Your junior doctors are anyone FY1s, FY2s, or SHOs. And your sisters are your nurses. You can use that term interchangeably, I suppose. So what should you know about the staff here at Ealing Hospital or any UK hospital? They're absolutely wonderful. They're very warm and receptive. They love to teach, so if anytime you're ever confused or just need some help, go ahead and ask anyone. They are more than willing to help you. In terms of getting teachings from consultants, they all want to teach. You just have to figure out a schedule, go ahead and ask them, what do you want to be taught about? And a time and a place. It's really that easy. A few things. You can get a lot of hands-on experience, however, you have to be proactive. If there's ever a day where you just don't know what to do, easiest thing, introduce yourself. Hey, I'm so-and-so, I'm an AUC student. Can I join your team? 99% of the time, they all say yes. A few other things. Travel. Get out as much as possible, but don't forget to give your 21 days of notice of leave of absence. Travel to as many countries as you can. It's pretty cheap and you're already here. See the sights and sounds. You can get, as a student, you can get discounts in terms of when you use the rail. So make sure you sign up for that. And as an NHS badge holder, you get discounts at various restaurants and stores. Just ask around. And welcome to the UK.
If you've not worked in a hospital before, the environment may seem strange and possibly a little intimidating. It may take some time for you to adapt. Being a student and learning in the hospital setting is very different from learning sciences on the island campus. You will not have a fully timetabled day with didactic sessions one after the other. You'll learn by being part of the team and learn from the experience, seeing patients and grasping opportunities as they arise, often unexpectedly. There may be gaps when little is scheduled, and knowing how to make use of these times is a useful skill. You will need to use your initiative and develop talents in self-directed learning. You are allowed and covered to undertake simple procedures and assist in surgery, OBGYN, anesthesiology, but you should always be under the supervision of a qualified doctor. You'll be privileged in being given the responsibility of knowing private and intimate details about your patients. Confidentiality is an important aspect of being a physician. Do not discuss patient details except in private. Do not gossip or joke about patients, and do not leave written material about patients around. Dispose of all sensitive material in a designated shredder. Do not take it out of the hospital or put into an ordinary trash can.
And her CT scan showed she's got multiple hepatomas in her liver, ascites, and I think it'd be a good idea to do a diagnostic tap of her ascites, maybe send it for histology or cytology. I think it's quite likely, but I don't know if she's got any idea that it might be the case.
The spread of infection around a hospital is a serious issue for patient safety. Most hospitals have alcohol-based hand rub dispensers around the building to use between seeing patients as well as on entering and leaving a ward or department. You must use these. If you have a patient with diarrhea, particularly if it could be C. diff infection, or you have a patient who has influenza, you must wash your hands at a sink with soap and water after seeing them. If you have a patient with an infection who is in isolation or on the intensive care unit or is colonised with MRSA, you should wear a disposable plastic apron and disposable gloves when you're with them. Dispose of these items before you leave the room in the designated trash can. If you have a patient in respiratory isolation, you may need to wear a special face mask when in the room. There will often be a sign on the door to this effect, but you should check with the nurse in charge on the ward before you go into the room. When you've undertaken a practical procedure, you may have some sharp implements left that you need to dispose of very carefully. So all sharps, whether you've used them or not, go straight into a sharps bin for safety. It's your responsibility to dispose of the sharps that you've used, nobody else's. Don't leave it to anyone else. If you're unfortunate enough to suffer an inoculation injury, and that can mean you've pricked your skin with a needle, or maybe you've had a splash of body fluid in your eye, you should seek immediate help. Each hospital will have its own policy for what you do if you suffer an inoculation injury, but you shouldn't waste time. You may need to go to your occupational health department if it's open, or the emergency department in other instances. Most hospitals will have a dress code. For example, you shouldn't really wear jeans or trainers, and for hospital hygiene reasons, you should wear short sleeves or roll your sleeves up. Men shouldn't wear a tie. If they do, it should be clipped to their shirt. This is called a bare below the elbow policy. When on OR duty or in the labour room, you may be issued with scrubs. You're required to keep a log of all your clinical encounters, the patients that you've seen and their conditions. This has to be anonymised. You can keep a paper log, but you're advised to enter your records onto the Millennium Programme. All hospitals will have rules about smoking, and really you shouldn't smoke anyway for your own health, but you shouldn't smoke at all within any of the hospital grounds. Coming to England and studying in a hospital setting is a big life event. Some of you may get homesick, or you may get quite depressed. There is always help available. Go and see your site director or someone senior who you'll feel comfortable talking to, and get some help. Experiencing the death of a patient may be quite upsetting to you. In fact, it would be unusual if it wasn't upsetting. If you find this a problem, do discuss it with your consultant or attending, or somebody else senior who you once again feel comfortable with. The AUC associated hospitals in England may have different arrangements for you, and it's worth having a chat to your site director to find out who is the most appropriate person you could see to get some psychological support or help with emotional issues. For each core subject that you've undertaken, you will need to submit an evaluation, or perhaps 2 or 3 evaluations from the attendings, the consultants that have looked after you. You can approach any consultant that you feel you spent a good deal of time with and ask them to fill in an evaluation form, and please return this to your site director or coordinator to be sent off to us in the UK Dean's office at Ealing. Doing your clinicals in England gives you an extra opportunity to see the sights in the UK and Europe. You can take advantage of cheap airline tickets with EasyJet, Ryanair and many other airlines. We have strict guidelines on how much leave for leisure purposes you are allowed. Please follow these carefully.
I've really enjoyed my time here so far in the UK. I've only been here a short while, 6 weeks, but I've already done a lot of procedures in the hospital. I feel part of the team. Everyone's been very warm and receptive and friendly. It's been nice to have weekends to be able to go into London and explore another culture and get to experience some of the life here in the UK.
So I've been here for 6 months in the UK, and I want to start first by saying that a lot of people consider this a backup at AUC. They're a bit scared of coming to the UK, to a new climate, a new culture, a different healthcare setting, different approach to medicine, different just culture completely. And for me, it was always first choice. I always wanted to come here and experience the UK, not only the healthcare, but also just live in one of the best cities in the world. Like I said, I've been here for 6 months for medicine and surgery, and I've done everything I've set out to do, everything I've wanted to do procedurally, and tagging along with teams. I've been able to do it. The only limitation is what you're willing to do and who you're willing to ask to do it, and as many people as you talk to, they're going to support you. From junior doctors to senior consultants, like everybody's here to help. And I think it's really important to come and experience a different atmosphere and a different approach to doctoring, a different approach to medicine that doesn't exist in the United States, and you can take home things from it that you wouldn't be able to in the States. They do things like, even in the act of percussion and palpation and listening, it's more detective work here than in the States, I think. And it's cool. I think you get a lot from following consultants and doctors, especially in medicine, and seeing a different approach to medicine that doesn't quite exist anymore in the United States, perhaps. And working in the NHS and working in a system where everyone's covered, and the positives and negatives, comparing it to our own healthcare system, and going back with that exposure, I think can only help. And you're a hop skip, just a short plane ride away from Africa, Asia, the rest of Europe. I've done plenty of that. And like I said, one of the best cities in the world. I'm not here by coincidence. London has the best music, food, culture of almost any city in the world, so it's a no-brainer to me.
Finally, I'm very glad you chose to come to England to do your core subjects in your clinical training. I'm sure you won't regret it. I hope you enjoy yourself, earn a great deal and have fun.